nutshell, the hand is quite complex. There are, so many different little joints within the hand that help it move. The joints are covered with cartilage, and with time, just like, tires on a car, those tires can wear out a little bit. And though the car may still drive, it just may not drive as well as you would like. So as that cartilage wears out, sometimes that can result in inefficiency of motion in addition to pain. And most patients come to see me due to pain associated with arthritis. Thankfully, we don't walk on our hands or our wrists, unlike our knees. So arthritis in the hand and wrist oftentimes don't, even severe arthritis, don't cause a lot of problems. But when it does, it usually manifests in pain or range of motion limitations. And there are different things that we can do for that depending upon what the patient desires. There are three main categories. One would be post-traumatic. Say you sustained a wrist fracture in your early 20s and the wrist wasn't set just right, or you had an elbow fracture. That is where the cartilage is rubbing on the other side, unevenly. That can create post-traumatic arthritis. The second type is degenerative arthritis, also known as osteoarthritis. This is probably the most common. You usually hear about osteoarthritis in the hip or the knees, but you can get it within your hand, and it's most likely it localizes to the base of the thumb. So right around this area right here. You can't see it in the camera, but right here is where most people will notice that it'll prevent them from pinching or grasping objects. So that's degenerative or osteoarthritis. And then there's autoimmune arthritis, and these are the ones that tend to affect women more than men, usually an 8-to-1 ratio. And that includes rheumatoid arthritis, psoriatic arthritis, and there's quite a few other autoimmune disorders that could affect the cartilage within the hands. And those people generally have seen a rheumatologist prior to seeing me, but sometimes I'm the first person to see them, and I'm able to identify that this may be something that is best treated medically than surgically. So three forms, we said: post-traumatic, osteoarthritis, and then rheumatoid or autoimmune related arthritis. Really depending upon the severity. It can be intermittent, where it only happens when you're doing particular things. For example, sometimes people notice while they're playing the piano and they're stretching for those extra keys, they can develop pain associated with that. Manual laborers can develop pain in the wrist when they're using the hammer or different equipment or different forms of equipment. Or sometimes it can be constant for people who have pain at the base of their thumbs, which is the most common place to develop pain, or most common place to develop arthritis. That pain may be constant, may wake them up in the middle of the night. Yes, it can be constant or intermittent. It's different for every person, and that really goes into the way we treat patients.